All right, good morning, everyone. Morning, everyone, and welcome to those visiting online as well. My name is Derek Rutherford, Director in the School of Physiotherapy and representative from our research committee who organizes these PT Matters sessions. So it's a pretty exciting day today for us where we have, once a year, we have our PT Matters sessions as student presentations from the students from the School of Physiotherapy. So it's a pretty exciting day where we have a PhD student, masters in our rehabilitation research programs, and our PT student, our graduate students in our physiotherapy program presenting today. So before I begin, I want to start with a land acknowledgement where Dalhousie University operates on the unceded territories of the Mi'kmaq, Wolastoqey, and Pasco-Makati peoples. These sovereign nations hold inherent rights as the original peoples of these lands, and we each carry collective obligations under the Peace and Friendship Treaties. Section 35 of the Constitution Act 1982 recognizes and affirms Aboriginal and treaty rights in Canada. We recognize that African Nova Scotians are a distinct people whose histories, legacies, and contributions have enriched that part of Mi'kmaq known as Nova Scotia for over 400 years. Okay, so while the group gets set up for the next presentation, I'll just introduce them. So we have final year physiotherapy students. Ellie, Detremont, Sophie Nicholson, Michel-Etienne, Petitpas, and Alyssa Walsh presenting Humble Pie. Anyone? How is cultural humility described in health equity frameworks? A scoping review. So as they set up, this is one of the topics as part of the PHYT 6202 scientific inquiry class. In their final year, students are preparing systematic scoping or umbrella reviews and presented at our School of Physiotherapy Research Day, which in the past couple of years happened to align with our MScPT forum. So this particular group won the People's Choice Award for Best Poster Presented and did quite well in the class as well. So they get to present their work today for you in PT Matters.
What we want to start off with our question is, what of the first step towards achieving health equity is taking a bite of humble pie? My name is Ellie, and alongside my colleagues Michel, Alyssa, and Sophie, we conducted a scoping review about cultural humility and its role in health equity frameworks.
So to provide some context as to why this topic was relevant to us and why the themes we will be discussing are pertinent to our daily lives, 3 of our group members are all Acadian, and we also recognize that our history is inextricably tied to the Mi'kmaq and the history of colonization in Nova Scotia. So from sharing their knowledge and helping Acadians make it through the first few winters in Mi'kmaq to taking in and hiding children from the British during the deportation in 1755, they played a huge role in Acadian history and culture. These relationships are complex and nuanced, but Acadians would be here, and we wouldn't be here today if it weren't for the Mi'kmaq. So as part of our land acknowledgement, we did want to start off with that.
Okay, so here's an overview of what we'll be discussing today, and we're going to start off with the background. So health inequities, as we know, which disproportionately affect marginalized communities, are a persistent challenge in healthcare. This often leads to poor access to care, delayed treatments, and worse health outcomes. Addressing these inequities requires a deeper understanding of how we can provide more equitable care. One way we can address this is through the practice of cultural humility, which is a concept that first appeared as a replacement to cultural competence in 1998. Cultural humility is an essential tool for physiotherapists to help reduce health inequities, as it fosters a practice that prioritizes patient-centered care with diverse communities. Frameworks can help provide guiding structures on integrating cultural humility into their practice. However, there's a gap in research on how physiotherapy-specific health equity frameworks incorporate cultural humility, as most existing studies have been done on other healthcare disciplines. Therefore, the objectives of our scoping review were to, 1, describe the extent of peer-reviewed healthcare literature on cultural humility, specifically definitions, frameworks, and practice recommendations. And our second objective was to identify key themes in these definitions to inform physiotherapy practice.
So for our methods, to meet our goal, we focused on 4 major inclusion criteria. The articles had to be healthcare focused, had to include a definition of cultural humility. They had to include an equity framework and concrete practice recommendations within the literature. So we first tested our search strategy in Sinal, and then adapted and applied it to sociological abstracts, ERIC, and Scopus databases. We pilot screened 12 abstracts and then compared the results to reach alignment and help fine-tune our rigorous inclusion criteria. Our inclusion criteria, as we said, had to include specific studies. We all performed full text screening with 2 people screening each article and keeping logs on each study, and any disagreement was resolved by a third person. Then Alyssa and I developed a data extraction template and tested it with 4 studies. We extracted independently and alternated when it came to consolidating the extracted data. Once we had our data, we performed an inductive thematic analysis with an essentialist paradigm. Each one of us independently identified keywords, coded them, and developed initial themes. Ellie and I did that by hand. Sophie ran the data through in vivo, and Alyssa used ChatGPT, and then we triangulated those results and came to a consensus to develop our final set of themes. Then, as a group, we identified how these themes showed up in the definitions of cultural humility and throughout the rest of the included literature.
So of the 439 articles that we screened, 14 met our inclusion criteria. We noted that the health professions engaged in this area of research were mostly nursing, medicine, psychology, or some kind of combination of the groups. There was only one physiotherapy publication that we found and that we were able to include in our study. I didn't include any numbers beside the second list there, patient population and cultural context, because there was so much overlap between the study populations, a lot of intersecting identities of the ones listed up there. But the ones on the left, so Twins, LGBTQIA+, Indigenous, immigrant, and ethnic minorities were the most prominent. And then I'd also like to point out that almost all of our articles, which met the inclusion criteria, came from the United States. And the implications for future research, if you are aware of what's been going on in the United States, will be discussed a little bit later. Oh, that's still me. Sorry, here are our key themes, our set of themes, and as you can see, most of them were present throughout all of the literature that we found, with the 3 most prevalent themes being reflexivity, receptiveness, and collaborative relationships, and then reflexivity being present throughout all of our articles. And so cultural humility was broadly defined throughout all of the literature as a process of self-reflection, self-evaluation, and self-critique. And then in the frameworks included in the articles, they call for healthcare practitioners to focus on developing reflexivity as an essential component to cultural humility.
Okay, so for a discussion, I just wanted to show an overview of how cultural humility has evolved in healthcare and physio over time, coinciding mostly with the evolution from biomedical model to biopsychosocial in 1977. And while none of these components necessarily state reflexivity or other theme words, it's kind of inherent to those themes being prevalent throughout in order to have this transformation of care. In physio, I feel like we've had a bit of a harder time officially integrating culture humility into practice due to our broad scope and potentially the perception of PT both within and outside of the practice as being fixers or operating independently of other healthcare practitioners. Additionally, with our broad scope, regulations and more objective measures we have more of these to keep track of than we can count. So it can be hard or seem hard to also integrate these more nuanced or subjective factors into practice. So you can appreciate that it can be especially tricky to apply this from a regulatory level. However, there has been slow progress towards more culturally humble care as physios become more integrated into primary health care and with more specific standards being implemented at accreditation and competency levels. So some specific examples of culture humility in our and our themes in our competencies, 6.3 of integrating self-reflection into practice, and 3.1 of engaging the client in their own care and recognizing that need for collaboration. So as you can see, we have this understanding already to apply culture humility in practice. We might just not be as acutely aware of it. And in these few examples, there's a strong foundation that exists to step up and join those other healthcare professions in exercising culture humility. Obviously, having validated frameworks and gold standards to follow is helpful, and that's an important next step for physiotherapy research in particular. But we don't have to wait for that to get that more intentional process of weaving culture humility throughout our education practice. So as I alluded to earlier in that little timeline, this topic is new to us, but it's definitely not new, and it's relatively new to Western healthcare as well. The concept of culture humility is extremely prevalent throughout thousands of years of Indigenous leadership and community practices and knowledge. One paper in our literature review describes servant leadership according to Greenleaf, which is leading with personal power based in compassion and kindness, rarely referencing positional power, or otherwise valuing a low power distance. In other words, collaboration, reflection, receptiveness. This ties in seamlessly with our themes, and although it's spoken about in terms of politics or group leadership, it can easily be applied to healthcare. Additionally, as we mentioned, there's been work on this topic in other healthcare professions, especially nursing and psychology, for about 50 years. And when reading through this literature, you can see how they've adapted along the way as practice and definitions evolve. So I thought it was appropriate the other day when Ellen shared this slide in professional practice regarding physio's journey in health justice, and it ties in well with where physio stands with culture humility as well. So we had set out to find how culture humility is defined and applied in healthcare and what this could look like for physiotherapy practice. Essentially what we've come up with is that culture humility is complex, it means a lot of things, and it can be applied in a lot of ways, but as we've shown here, it's not really that complicated. If we can engage in culture humility, applying any of those themes or components in any way we can, so as students, teams, individually, it ensures it's not just a bonus byproduct of our care or buried in our checklist, but part of who we are as an important and growing piece of the humble pie we call healthcare.
So what? So we've discussed kind of the themes, what we found. The important part now is what we can do moving forward. You can take action immediately by integrating self-reflection into your practice, which is already part of your professional competencies as a physiotherapist, or otherwise if you're a healthcare professional. You can expand your professional reading list to include critical race theory scholarship. Add to reading lists books that come from various perspectives and discuss these subjects, specifically cultural humility, but also other related topics to expand your viewpoint. Consider racism-based traumatic stress a core competency that you should be looking at to understand where people are coming from and pursue CEUs and accreditation that is relevant to that. And finally, call it out. Hold structures and people in power accountable to any commitments they make to social justice, and don't be a bystander when you see things that don't align with those. You can find a really good resource is the calls to action that were put out by the Hood et al. Full article that we actually ended up including in our study. There's a full list of recommendations that go from government level all the way down to individual practice levels that are for the field of psychology, but in our opinion could probably be translated one-to-one to physiotherapy. And finally, we just briefly wanted to touch on our EDIA position statement. So as we mentioned, the majority of literature on cultural humility, social justice, and health equity originates from the US. They are a world leader in this research area and many others. The current actions of the US government to censor and dismantle DEI as a whole has reminded us about our privilege in being able to research, discuss the subject, and to actively pursue equity as practitioners. It's our responsibility as healthcare professionals to continue to break down barriers within healthcare, and it's part of that. So thank you so much for coming to our presentation. Special thanks to our supervisor, our teachers, and the librarian.
Yeah. And thank you for the pie, Marie.
Thank you so much.